Good morning. It's Friday, January 27th, and time for another legislative update from your North Carolina Medical Society. Three quick things again this week. We've started session. It's official this time. We're not going to say we're taking a break and we're going to be back in 2 weeks. We're here. It started. One bill has been introduced so far that relates to medicine. It was asked by the Academy of PAs for a clarification to make sure that the DMV placards for handicap folks could be issued by PAs and nurse practitioners. This is something that has been standard practice for a long time back home in your communities, but a recent interpretation by the DMV led them to believe that only doctors could issue those placards, and you can imagine the nightmare that that set forward. So this bill merely clarifies something that has been going on in communities across the state for a long time. We look forward to supporting this bill, and we hope that it gets done expeditiously. Second thing is the Affordable Care Act. We have talked with you about many times repeal and replace, or the improvements that we're expecting to be made to the Affordable Care Act over the next few months. The Republican caucuses for both the Senate and the House of Representatives up in D.C. are retreating this week to have a conversation about all the different legislative activities, but we're sure that the Affordable Care Act is one of the hot topics that's being discussed. So we're hoping that next week we're going to have more information about what's going on, what they intend to do as far as next action steps, and we can give you some better clarification about how to communicate with your congressional delegation. And many of you used the muster tool this last week to talk with your state delegation, and so we'll be utilizing that same tool to hopefully help you talk with your congressional delegation next week in some way. And last, I'll point you back to the bulletin this week. On Wednesday, many of you have already seen this, but there was an article about prior authorization principles that have just been adopted by the AMA in concert with the North Carolina Medical Society, the the National Association for Hospitals, as well as a number of other organizations. We recognize that prior authorizations are one of the most administratively cumbersome things that you deal with in your practice. And these principles really lay out a guideline for how we can make improvements on prior authorization so that insurers can use this in some way, but you can deal with it in a much better fashion so that we're focused on the medicine instead of on a bunch of hurdles and hoops for you to jump through. I'd encourage you to go back and look at that article if you've missed it, or if you read it, to go back and look at it one more time and share with us at the bottom your feedback about how these practices have impacted your business, have impacted your patients over the years, because that collection of stories that you share with us, without disclosing any HIPAA problems, without disclosing any names, just the hurdles that you've had to deal with, will help us go and have further conversations so that we can try to get these principles turned into something that actually gives you relief in your practice. So I hope you'll look back at that. We look forward to talking to you again next week, and have a good one here from Raleigh.